So first, I would like to ask for your permission to use this video for educational purpose and on internet.
Yes.
Tell me about your symptoms and life before the surgery.
So before I had the surgery, I have quite a bit of a desk job, and we have a lot of meetings, and it was getting to the point where it was embarrassing because when I would get up from a meeting, I'd be in an L-shaped formation and have to walk quite a bit.
Bend over,
and then walk to get back up like a duck walk, and then pretty soon I could get myself back
How
up.
bad was the pain, 1 to 10?
Well, I think I kidded myself, and many times it was 5, 6, and then it would be 7, 8 because I couldn't work when it was 7, 8 and be at home, and sometimes 10. And I'm not good about rating my pain as severe, but other people would look at me and I'd say, oh, there's other people worse than me, and they're like, seriously? Because I don't see too many people bent in an L shape.
How long was it going on?
Well, close to a year before I had surgery.
Yeah, and we obviously tried everything else, but you had a scoliosis in your back.
Correct.
And you had severe degenerative disease in your back, and you have a legitimate pain, and you're officially a tough woman, because most of people, they in a similar situation with similar films, they rate their pain 12 of 10. They call it 20 of 10, but so you're very humble to call it just 7 and 8. Now, your daily activity, besides standing up and so on, how far could you walk? What was your daily activity
I gave up all walking, so I considered myself to be an older than average athlete. I did 10Ks before, ran them and did all that, and even power walked. And really, for the last year, I have not really done anything. I couldn't exercise, and I could not walk. I didn't trust myself that my back would work.
Quit living?
I did. I just stayed in my house and I didn't go out. I'd get invited to places and I would make an excuse why I couldn't go.
Now, did you hear about, what options were available to you before the surgery? Like regarding surgery, surgical options?
Yes, I had seen a neurosurgeon before you, and so it was the traditional, we're going to cut your back, and then I'd had a knee surgery that was fixed, and for some reason that relieved the pain in my back at that time. I was very fortunate, so I just kind of let it go, and I'd have bouts here and there, and then I just kind of waited because then I heard that this was less invasive, and I thought, well, anything that I could do that would get me up and going faster is more appealing.
What did the other surgeon, without calling names, what did he tell you about the surgery, how it was done? How would the recovery be and so on? What did he tell you?
He didn't even hesitate. He didn't really go into a lot of detail. He just said, matter of fact, you'll be off 12 weeks of work, and then you'll have to, at that time, it was like you wouldn't even do physical therapy until 12 weeks. That's how debilitating the surgery would be. And I'm just kind of like, ugh, that doesn't sound very good. So that's what he told me. Otherwise, he didn't really get into a lot of the issues.
When was the surgery?
I didn't have surgery with him.
No, but with me.
Oh,
surgery
with you?
Me.
Little over 3 weeks ago. It'll be
3 weeks ago.
It's a Monday, and it'll be 4 weeks this Thursday.
Now, we talked as well about that you are not even my best result because you had the nerve root irritation because I had to push those nerves to the side, and we talked about that extensively before the surgery, and you had it. But you told me that's getting better. Explain to me, how did it feel, that new pain that was going down the legs? Where was it, and how is it now?
So I had surgery on a Thursday, and I can tell you to the time, it was Monday after surgery at 4 o'clock, and I didn't quite understand what was going on, and it felt like a hot, searing knife going from my left buttocks all the way down, and then it would wrap around and come down to my knee. And actually at that time, it was just mild, but it went to my ankle.
So these are exactly L2, L3, and L4 nerve root that I had to push to the side to correct your scoliosis.
You called them, they would get angry.
Yeah, and they did.
And they did get angry.
How is it now?
It's so much better. I have to be honest and say that from my left buttock to here, it's numb, but not so numb. It's not painfully numb, and it's, when it's at its worst now, it's probably at a 3 or 4.
But it's getting better.
It's
already
getting
3.5 weeks after the surgery.
All the time, and I have been doing physical therapy really from almost that time frame on.
Yeah.
And I think that's helped in doing a lot of walking.
Some basic questions, how long after the surgery did you start walking? Did you walk same day?
Well, I had it later in the Thursday afternoon, so next morning I got up and walked.
Yeah. And how long did you stay in the hospital?
I went home, actually, I could have went home Friday, but because my son lives so far away, we have made arrangements on Saturday morning for him to come and get me.
Usually a night or two is what my patients stay in the hospital, so you are within. Whereas after open surgery, people easily stay about a week or two in the hospital. After open surgery, the earliest most of people walk is 2 or even sometimes 3 days after the surgery. And how has it been the life, even though you are not my best result, but how has it been the life, your daily activity since the surgery? How is the pain?
Well, very good, and I am very consistent with my exercises, and yesterday I did a milestone. I walked a half a mile, and I stopped and rested on my cane, but I actually just kept my cane with me and didn't use my cane to help me walk, so I was really happy with that, and I've not ever been bent over, not once, and I've learned to log roll, get out of bed, and that's even getting better. I can push myself up in bed and really not have much even of back pain.
Only people who have done, like hundreds of open surgery and hundreds of this kind of surgery, they truly understand how, unusual it is for somebody who had a spinal fusion surgery, which we are going to look at, to describe that going half a mile, and being at your level of improvement just 3.5 weeks after the surgery. And so this is everything you told me is actually pretty average in what I expect, except that most of my patients don't have that nerve irritation. But even with that, you're so far ahead of the open surgery. Now we are going to look what we did. You had a scoliosis with a cup angle that was approaching somewhere between 12 and 15 degrees, depending on the cuts. We did a 3-level OLLIF fusion. This surgery took us less than 1.5 hours, and we barely lost 3 ounces of blood. And here are the screws. And one of the things we do in our technique that we put these screws, and if you look carefully, we put the biggest screws to hold you in place. And our screw is barely, smaller than your pedicle or where they need to go. You see that, but they're dead center. That is because of all the training and technology that we use, and they're in perfect location, and they're holding you in the place they need to hold you. And more importantly here, look at that, they're really well centered, is that here is the hole where the nerves are going out. This hole, we call it foramen, and they're very well open. And as a matter of fact, they're much bigger than your natural other level of where we didn't do the surgery. These holes are even bigger, and that is why people get so much improvement as well in the legs right after the surgery. Now, besides that nerve irritation, have you had any pain going down the legs since the surgery? No. Excellent. Now, it's still going to be a road after this big surgery. Most of my patients report that most of the improvement comes between the 4th and the 8th week. And in the first week or so, sometimes it can be, even without nerve irritation, it can be tough. People just figuring out. But the idea is that if you compare it to somebody who had old-fashioned surgery, after old-fashioned surgery, not the first week or 2 is tough. The first 6 months is tough.
Well, I do know somebody who had traditional surgery, and as we were talking about this surgery, I had to stop talking to her because she told me that for the first month she never slept in bed. She slept in a chair right straight up like that, and then she also said, be prepared that you might have to go to the nearest hospital and get a pain injection because I couldn't take it. And I'm thinking, I don't think I need to talk to her anymore. And I didn't have any of that. I've been sleeping in bed from day one.
So far, you're already ahead of the open surgery.
Absolutely.
Well, thank you so much for this interview. I really appreciate that.